Hi, and welcome to Chronically, formerly known as Concussion Talk Podcast. My name is Lauren Zayaks,
I'm Nick Mercer.
and we're teaming up to talk about all things chronic illness. We'll still be talking about chronic concussion, but we're going to follow a lot of other journeys along the way. So make sure to subscribe and check back in. Thank you so much for spending your time with us. Yeah. I
Yeah.
mean, that's always a hard conversation with a student athlete, especially sort of being out in the wild, not being in these contained university or NFL settings. But if a student had dyslexia and challenges with learning before, if they had headaches with reading before, I mean, my goal for them is always, I sort of tell them like, oh, this is like an added bonus, right? Because there's actually some
Right.
therapy you can do for those
Mm-hmm.
things that you had at baseline. And so we
Mm-hmm.
got you because of the concussion, but we probably can eke a little extra out of your quality of life. And then you have to make
I
that
know
complicated
exactly.
decision with the doctors of when is that point that you've crossed that line where
Mm-hmm.
you're really at your baseline, which needed some help, but we can't hold you back just because you had access to good care and not let
Right.
you play because you aren't back to normal for whatever standard we've created for everybody else.
Right. Exactly. And kind of related, but also distinct. There are some individuals who do not have a history of headaches or migraines, and then they get their concussion and they have their normal concussion recovery, so to speak. But this individual, I don't know, might have a really strong family history of migraines. And many are teenagers, which is often when headaches and migraines disorders start, regardless of whether you sustain a concussion. So then it's like the concussion we believe recovers except for headaches or migraines. But on exam they're totally fine. Their balance is great. Their ocular motor functioning is great. Their cognitive skills are great. Their brain scans look totally normal, but they still have these headaches and migraines. And then we have to ask, okay, is it still a concussion related headache slash migraine? Or might they have developed this disorder regardless of the concussion at some point in their life? And did the concussion just bring it out earlier? Again, trying to say, like, how do we disentangle what is someone's kind of biology versus what is concussion? And that's another really tricky discussion.
Because
Yeah.
exercise in
Speaking.
general is so important, right? Like we want you to be a part of a team. We want you to be back
Mm-hmm.
exercising, hiking, living in Park City, skiing, snowboarding. Like we don't want you to be afraid of going out and doing things, and we want you to be as healed as possible at the
Right.
same time. Yeah. Nick, you look like you wanted to say something. Sorry.
Oh no, it's just a question, but kind of to both of you. Yes, it's kind of maybe can be too complex for one podcast. Definitely. Like like you were saying earlier that it's all together. It's all one. It's like Terry, you were saying there. Sorry, Doug, you were saying that it's all one. Like the social aspect, return to learn. Whereas like return to learn is more individualized. So you can kind of see like how that's kind of just you gotta get yourself right and anything else matters really. But then return sport is social in the most sports, and it's actually running or swimming or just and though it's more I mean that is collaborative. So it's more collaborative. So does that impact like your social aspect? Does that have an effect medically on your say on your ability to your headaches, your headaches and any other physical symptoms you have that stem from the
Yeah,
brain?
I think that things in general that are helpful for headaches are exercise.
Yeah.
Getting
Oh,
someone back to some form of exercise. Now, it doesn't have to be their full contact sport.
yeah.
But like in general, exercise is being used as a treatment for headaches and migraines.
So
As
like
in,
just being in the locker room,
say that again?
just being in the locker room is
Yeah. Exactly. And just in general, as you were touching on, there are so many social positives to sports participation, whether that be, the full cardiovascular and physical health, but also the mental health aspect and the social skills building and teamwork and camaraderie. All of those things are super helpful in regard to, just overall brain functioning. So I think that we want to be safe, but we also want to inspire, people to be active. We know it's good.
Yes,
People will say to
I know
me,
you also do work with veterans too, with Army veterans, and it must be very similar to what you do with in professional sports, like the NFL, like the Titans or the Predators or the soccer. So is that's very just very kind of similar. I know it's not the same environment, but it's very similar
Right,
kind of
right.
symptoms.
Especially, yeah, and especially in Army veterans, or other, types of special forces or armed services, there can also be a very separate but real and important mental health burden, in a lot of those individuals, as well as orthopedic health, aches and pains and back
Yeah,
problems or knee
that's right.
problems, shoulder
Yeah,
problems. And those physical things can obviously, not only create pain, but limit someone's exercise ability. So,
yeah,
and that's why, concussion treatment, we're adding more and more specialties to the circle, because, there's so many things that affect the brain that we want to be comprehensive and get people the best care ever. It's easy to get athletes back
yeah,
to sport. They often want to, versus,
yeah.
with a veteran, for example, who unfortunately might not be as young anymore, but have a variety of chronic orthopedic pain types of issues. There are barriers and hurdles that we have to individualize our treatment for a
Yeah,
person.
so you're seeing it again back to sport. How do you, when you're with the NFL or with the NHL or with soccer, but especially in pro sports, deal with the gap between having to get the player, somebody back out into the field or the ice or the rink. Well, it's the ice, the field, yeah. The court, I don't know, whatever. But yeah, getting them back out there and between say their like the speed of just one game, like someone get hit in the head or someone just falls, says, okay, that's concussion, that's not concussion. Like, how do you bridge the gap between the need to get that person back out there for obviously pro, they have to be out there for the fan, for the take the whole ecosystem to work.
Yeah, and one of the things that I think the past 10 or 15 years has done is that, the rules at the pro level are very similar to the rules at the youth level.
Right.
So
Oh,
seeing that consistency and
right.
care, I
Yeah.
think, is really important. But largely speaking, like, we have to, the healthcare team needs to think that the symptoms the person reports is back to their baseline, whatever that baseline might be. We all have different baselines, but, are you where you were symptom wise before the injury happened? And are you looking good, and normal or similar to your preseason baseline on measures of balance, thinking tests, eye functioning? Are your nerves intact? And at that point, we take you through a multi-day progression where each day we're kind of reconditioning you harder and harder. So, that's where we say, like, day 2 of the return to play protocol or
Yeah.
day 3. So there is this kind of standardization. On
Yeah.
some level, it takes, judgment away from an individual provider, which, is good in the sense that the field has these accepted standards where, one doctor can't just be like, you're
Yeah.
fine, get back out
Yeah.
there, and another
Yeah.
doctor is keeping you maybe unnecessarily for 3 months just because that doctor might have
Yeah.
more anxiety that they don't want
Yeah.
to be sued, or any of the
Yeah.
things,
Yeah.
and I
Yeah.
joke.
Yeah.
So,
Yeah.
I like that it's standardized, because it helps everyone kind of achieve the same thing.
Yeah. No, it's like a, so I know when people look at some a hit or like anything, a collision at all, they'll see what looks like, oh, that person's gonna be concussed or gotta be, but what do you think people should know, or would you like people to know about like seeing as what it looks like from the outside and what it feels like from the inside, which you were actually you spent your whole career doing.
Yeah, I know. This is really tricky, and it's a huge point of public interest where, we're watching our pro sports program and we see an
Yeah.
individual take a
Yeah.
huge hit.
Yeah.
I will say at the level of the NFL, we do not take these things lightly. If that person looks in any way, shape, or form concussed, they are off the field and getting a full evaluation. The NFL has not only all of the healthcare providers for the home team and the visiting team, but multiple individuals in that stadium, 5 individuals in that stadium on game day, whose sole job it is to spot head injuries. 3 of them are physicians and 2 of them are athletic trainers that are all they're doing is looking for head hits and the after effects, like getting up a little wobbly or being really slow to get up, things like clutching your head or shaking your head, having tonic-clonic posturing, or the fencing response, loss of consciousness, obviously. We're looking, and if we see any of those things, they're getting an evaluation. Interestingly, the NFL on average does 3 to 4 of these evaluations just to diagnose a single concussion, right? We are perfectly happy with a lot of evaluations that do not result in a concussion because, again, we're all about being better safe than sorry. We would rather evaluate the player and validate that they are safe and not concussed and they can safely return back to play. And obviously we're catching, nearly all of the concussions as they occur. So, we're really happy and proud about those statistics. And we don't, we're happy to over evaluate in that sense.
I think that there's 2 important things there. One is the idea of spotters for parents listening, who have kids that are playing sports, right? Part of the reason that there's so many spotters is not just for the big injury that everybody sees under the spotlight, but there could be injuries further down the line or whatever the sport may be, right? And so you sometimes, when we're looking at the exciting part of the game, if you will, you kind of forget about all the people who make the exciting part possible. And
Right.
sometimes they collide or they hit the turf too hard. And I believe part of the reason of having so many is A, so you can have consensus, but B, so that you can watch more of the field. Is that accurate?
Absolutely. Absolutely. And they're strategic, and these 5 individuals are strategically positioned. There's 1 on each sideline, and there's 3 up in the booths. There are also dedicated camera operators to so the spotters are looking at the play in real time, and then they can also look immediately after down at their panel where they have multiple screens, so they get to see multiple different angles and viewpoints a second time, about 7 or 8 seconds after the play has actually occurred. And then each person has an assigned camera operator, and you can say, I want to see this exact person, but from a different angle. And then the camera operator is doing all the clicks and things that are technically beyond my control, my ability to speak eloquently about. So we can really be sure, like, hey, was this person, defenseless and falling versus, did they not brace themselves for the fall, or did they look out for a second? So yeah, and there's a whole training. We have, videos that we train everybody on, and the spotters have to reach a level of accuracy when we train them up. Yeah.
That's amazing. I mean, I worked 3 seasons of football. I don't think I watched a single football game because my job was always the line changeover. So it was always check in with everybody and try not to get hit from the back while your back's to the field, sort of, sort of thing. Hope the guys like you and will look out for you. But you always want to make sure you're looking for the other players outside of the person right underneath that spotlight. And then the other point that I thought was important is, of course, we want to take care of our athletes and our professional athletes. But also, these guys are heroes to so many kids out there, right? And so a big important piece of them being pulled off the field, even if there's 4 of them for every concussion you actually find, is we want to set a standard, a perceived social norm that getting evaluated is just part of the game. And we want them to speak up. And we know the statistics of 1 additional play, how that will change your trajectory of your ability to heal. And now we have sideline assessments that we can use where you can sometimes get right back out there again, right? And so getting their heroes to go along with this protocol without a fight is so important because it trickles down to the 12-year-old who's playing football on a Saturday.
Right. I think that's an awesome point. And to expand on that a little bit, we truly believe, at least at the NFL level, the stigma of reporting a head injury is going down, because for each one of these evaluations and what ends up being diagnosed as a concussion or not, we track Why did this evaluation occur? Did the evaluation occur because the athletic training spotter triggered it? Or did the player himself trigger it? Or did the coach or a teammate trigger it? Or was it one of the sideline neurologists that triggered it? Or which of it, and there can obviously be multiple triggers, right? But as it relates to the self-report, so the athlete themselves reporting the concussion, we have steadily seen that increase over time. It's about 40% of concussions at this point are self-reported, which is far higher than it was a decade ago. We have a paper that's currently under review showing these trending data over time, and hope to have that published as it relates to this, spotters program and unaffiliated neurotrauma consultant program, and just the changing stigma over time.
I mean, I remember the days where you'd catch a guy with smelling salts in his pocket. So
Right,
that's a
right.
huge change in what you would expect to see. Now, I'm going to make a hard pivot because we only have so much more time with you. And I
Sure.
really want to talk about some of your work in the long-term effects. So what happens down the road after a concussion? I know that you've done a fair amount with depression and anxiety and, cognitive decline. So I want to leave it open to you of where you want to go, but that's kind of the last piece for this chronic symptoms bucket. What are we learning? How are we going to have a positive spin on this? And how are we going to help people who are already maybe further down the road and they don't have to feel like it's doomsday? I'm absolutely going to get CTE or something like that.
Right, right. And I think these are such important topics, and they can be life altering, in both the thought and the fear and the reality. CTE is a buzzword. It's been around, or it's described in one way, shape, or form for almost 100 years. I believe the first documented discussions around what we would at the present day call CTE was in 1928. But and it was written about in the 1900s by these old school neurologists, and they didn't know much of it, but it's kind of chronic brain damage in boxers. But now that we're studying it with modern technology and modern imaging, and so much has happened, yet we still don't know a lot, because humans are different and humans are complex. So I guess maybe a starting point would be, head injuries we want to minimize, concussions we want to minimize. And I think we all know that things can have later life effects, but also every symptom I'm experiencing probably isn't due to just maybe one single factor. We have to look at all of the factors a human has, because other things that affect cognitive or memory skills or mood could be pain, just orthopedic pain, right? Like if I'm in actual pain, I'm going to be irritated and snappy, and that pain might distract me from remembering things really well. Or other conditions like high blood pressure and high cholesterol or diabetes. While we often think of those as heart issues, they can also affect the brain. They can affect the vasculature in the brain, and people can have legitimate memory issues and dementia-like syndromes due to those vascular risk factors. Those vascular risk factors also put people at a higher risk of depression. So all of these things are intertwined, or sleep apnea is a huge one. I just published a study with former colleagues of mine at Harvard in the Harvard Football Players Health Study. This is interesting in my opinion, and I'm sorry if I'm rambling. I'm just a super nerd. So we asked like 2,000 former NFL players if they have been diagnosed with sleep apnea. Yes or no? It's just, have you been diagnosed with it? And about 31% of them said yes. And I was like, okay, that's substantial. But I've met a lot of these guys. I treat a lot of these humans. They are big people. They have big necks. And in general, men are more at risk at sleep apnea than women. People over 50 are more at risk at sleep apnea than under 50. And if you do have things like high blood pressure, high cholesterol, and if you snore, which almost all football players I talk to say they snore, all of those things put you at a higher risk for sleep apnea. So while only 31% were diagnosed, based on
Right.
all of the risk factors that these same individuals reported, we actually think the real prevalence of sleep apnea might be about 69%. As in, there's like a good 40% of former NFL players who likely have sleep apnea and might not be diagnosed with it.
Wow.
Other fun facts is that of those 31% who do have it and know they have it, only half of them are deciding to treat it because probably that CPAP is
Yeah.
unpleasant
Yeah.
and oppressive. But they're not getting the treatment that they need, and I want to help serve those individuals. And the last fun fact about sleep apnea is that when we control for all of these other nerdy things, like how old they are and how many concussions they had, how long they played in the NFL, we controlled for all of that mathematically. But those individuals who had untreated or undertreated sleep apnea had higher rates of depression, anxiety, and memory issues. So, like again, it goes back to this notion that the brain is complex and the symptoms we
Yeah.
experience could be coming from a variety of different health issues. And we might be able to treat a lot of those health issues.
Yeah. I mean, and then there's central apneas if you've had a head injury, right? And
Mm-hmm.
I mean, when I was
Mm-hmm.
with Georgia, we were the second largest line. I think the Bengals were the only team larger than us. We were 380 pounds average. So I would
Right.
100% expect that number to be astronomically higher than the self-report. And I would think that the 50% treatment rate is probably pretty on par with the general population. Right? I mean, people historically struggle with the treatments
Mm-hmm.
for sleep apnea, but it
Right.
sets you up for cognitive decline from lack of sleep, but also there's other health risks like stroke, and there's other things that go along with it. So if you are waking up with some of those symptoms of sleep apnea, it's really important that yes, it's uncomfortable and you feel like Darth Vader, and also you treat it because that's what's right for you and your loved ones, right? You want to be around to see your kid walk down the aisle and things like that.
Absolutely. And, everyone has the notion of the Darth Vader mask, but there's
Yeah.
also a ton of progress being made in sleep
Truth.
medicine treatments. There are devices that you can use that are a lot less annoying than the CPAP. The CPAPs are also getting smaller, more comfortable, and less noisy. There are surgeries, like minor surgeries, that you can get to kind of bypass the system and help. And obviously, this is at an individual level, so not every human is offered every treatment. But I would hate people to make decisions about sleep apnea based on information that's 20 or 30 years old.
That's
I
good.
have a
Have they
question,
invented
Christian,
a
about the.
plastic yet? Oh, sorry. Have they invented a plastic yet that the dogs don't prefer? Because what I remember from when I needed mine was there's something about the smell of that plastic. They warned me at the location.
Right.
Dogs love to eat these, and I did not take it seriously, so I had to buy way too many replacement masks.
That's, yeah.
I was gonna ask
Sorry,
about
Nick, what were you gonna say?
the Braithwaite trips, the play like I mean, this is probably a very esoteric thing, but 'cause I know somebody probably wear them stylistically, but I mean, but is there a link between say the players who wear Braithwaite strips and sleep apnea, like percentage wise, not necessarily?
I don't know if that question has ever been asked, but I love it.
Yeah.
And there's so many things that are tracked with elite athletes, and then we constantly think of new things that we don't track. So yeah, so I have a lot of questions now, and I might reach out so you can collaborate with us on that
There you
idea.
go.
I'll give you full credit,
Perfect.
Nick.
Perfect. Thanks.
And then
I feel.
I want to just ask one more question about the chronic symptoms, depression, things like that. So we both kind of discussed the way things used to be, and we didn't really do anything for treatment. And now there are so many treatments for all of these
Hmm.
different symptoms. I don't know if it's just because of my own head injury history personally, so I have a very biased opinion, but I have to hope that the work that we're doing for the long-term follow-up is very important. And is it possible that now that we're actually treating these injuries, that focus will change, the trajectory of illnesses will change? I think it's reasonable that this extreme cognitive decline occurred when people used to use smelling salts and get hit 4 or 5 times in a game, right?
And
And
get right back in, even if they were still symptomatic. Yeah.
Exactly. And then the role of, my work is in dysautonomia, so exercise and upright intolerance. And so
Hmm.
now that we even know that's a piece of chronic concussion symptoms and the neurological benefits of exercise, if we can just get people back to being able to do cardio, back to being able to tolerate movement,
Hmm.
is it wishful thinking, or is it reasonable to think that maybe that could help us in the long run not have these same outcomes that we're going to see for the next few years in the people who didn't have that luxury?
Right. And what you're kind of touching on is almost like a generational shift, right? Like the generation before us um, had one way of treating or lack of treating concussion, versus now we're treating it so differently and what we think to be a lot better and carefully and appropriately, and that could 100% change the course in a long-term way. So the things that we're seeing in individuals who are currently in their 60s, 70s, and 80s might not be what we see in the people our age in 30 years. Fingers crossed, I know. But I think that's a big question, and I think that's why the NFL is taking such efforts to think about ways. The best head injury is the one that doesn't occur. So even if it's not a full concussion, that's why we think about guardian caps. Like, not only do guardian caps at the level of the NFL reduce concussions in preseason, but they also dampen head impacts. So, something that might have been 40 G-forces might be something like what actually gets into the brain due to the guardian cap might be 20 or 30% less than that. Or, different practices where we're limiting contacts, or, rule changes that are keeping those things from occurring. Yeah, we don't know the downstream effects, but I think we're all hopeful that that'll make a difference.
Well, I guess, like, I mean, aside from the research, is there any research that you wish existed that doesn't, aside from, say, the timeline? I mean, the no, like, history, like, need, like, concussions have really been cited in the past about 20 years, like,
Right,
appropriately. Whereas I
right.
know, and it's long term, but aside from that, is there any research that you think would that you wish you had your hands on that doesn't exist?
Yeah, I mean, I think the next frontier in the short term, so to speak, because yeah, I wish I could go ahead 30 years and look at those
Yeah.
outcomes, right? But I understand your question. I think
Okay.
short term, what I would hope to see is one, we do so much on diagnostics and the gold standard for
Yeah.
diagnosing concussion, and that's already taking off. But I also think that treatment, especially in the mental health realm, or how to cope with symptoms realm, which is kind of mental health, kind of neurological health, and that coping.
Yeah.
I'm really interested to see where that goes in the next several years. I think about my wonderful colleague, whose name is Noah Silverberg. He's at the University of British Columbia in Vancouver, Canada, who's doing a lot of trials, both with sports and not with sports, as to, hey, you're already 2 months out and you're really struggling getting back to stuff. What can we do for you? And we know physical therapy, and we know a lot of the physical treatments, but really kind of formalizing and manualizing the psychological aspects, I think, is super important. The other, I think, thing I would love to see more of is what Lauren specializes in, is the autonomic and cardiac and exercise intolerance piece of it, and how that relates to POTS, postural orthostatic tachycardic syndrome, right?
I know that one.
You got it.
Yeah, I was like, wait a second, I can do this. Um, we're seeing more and more athletes reporting this exercise intolerance, and sometimes it's associated with a drop in blood pressure or a spike in heart rate, but other times we don't have those biological things. And what does that mean? Just having this intolerance. So there's a lot more work to be done in that sense.
Well, I'm
I
available
well, I
anytime.
would
I'm
say,
just kidding.
Lauren, you got your work cut out for you now.
I
Gotta
love it.
get on the
Well,
papers.
we do have to let him go. He's very, very busy. But we appreciate everyone. First of all of you listening are very busy as well. And so we appreciate you taking the time to come and join us for today. Doug, thank you. Dr. Terry, thank you so much for taking the time. Is there
Nice.
anywhere people can reach you? Do you want to be reached since you have 4,000 jobs? I don't know if you have social media.
I'm not that active on social media, but if you Google my name, you'll find my Vanderbilt email, douglas.terry at vumc.org. Happy to field any questions, but it was so lovely. Thank you guys so much for having me here today and talking about these important topics and carrying the flag for a lot of individuals who want good information.
Yes, thanks so much.